Greetings and welcome to this presentation by the OCI Foundation. I'm Dr. Chris Ifediora, the President and founder of the OCI Foundation. In this 10 to 15-minute video presentation, I'll take you through sponsorship and partnership benefits, pros and cons by partnering with the OCI Foundation in its flagship health promotion campaign tagged the Arm Our Youth campaign. It is an awareness program against breast and cervical cancers that will involve all Nigerian secondary schools in the years to come. This might well be the best part of your 10 to 15 minutes if you're able to finish this video presentation, because there are huge benefits to all corporate bodies, governments, private institutions, NGOs, everyone, and millions of lives will be saved. First, let's look at the problem. Cervical cancers. Well, in 2012, developing countries, which as you know includes Nigeria, accounted for more than 84% of all global cervical cancer occurrences. And in addition to this, it accounted for 85% of the resultant global deaths. These are a huge number, but even numbers from Nigeria are more interesting. Well, of our estimated 200 million, 54% are women. About 50.3 million Nigerian women aged 15 years or more are at risk of this cervical cancer. And it gets interesting from here even, because in 2017, about 8,240 women out of the 14,089 Nigerian women that were diagnosed with cervical cancer died. Scary? It gets worse from here, because in 2025, projections by the International Agency for Research on Cancer suggest that these numbers will rise by 63% among Nigerian women that are aged 65 years or under, and will also rise by 50% in women that are over the age of 65 years. Well, another phase of the problem is with breast cancers. It's the commonest malignancy worldwide apart from lung and non-melanoma skin cancers. It's the fifth commonest cause of death from cancers globally. And in 2015, it accounted for over 500,000 deaths globally. Its incidence in the developed countries are on the increase. With 1 in 20 in 1960, it currently stands at 1 in 8 women that will develop this cancer. Fortunately, the incidence is lower in Nigeria, but we know it's gradually matching the numbers above because our lifestyles are changing. Our women take longer before they have their first babies. They stay longer in school, some smoke, some drink. These are all factors that increase our risk of breast cancers. But unfortunately, our survival rates are less compared to those in the Western world. And out of one out of every 10 women affected in Nigeria and other development countries will survive. That's 1 out of every 10 that has breast cancer will survive. Contrasted with the numbers from the developed world, where 7 out of every 10 women will survive. Why is this? Well, Nigeria has no government-sponsored screening, diagnostic, or treatment facilities. So what's the solution? What do we do? Well, do we just fast and pray? Do we just continue to wait for the government to do this for us? Do we continue to wait for foreign aid? Or do we empower ourselves and fight these two cancers? Well, at the OCI Foundation, we made a decision to stand and to fight with our women. And this presentation is an invitation to you to join in this fight on our side. Well, in this fight, everyone is a winner. Everyone, our women, and our men, because our men will have wives, we have mothers, sisters, daughters, girlfriends, associates, and grandchildren. And our societies will be winners too, our country, and the companies that will employ healthier, productive women just by this very intervention. So join this fight, because we have real solutions. 3 strategies we know exist to fight the duo of cervical and breast cancers: vaccinations, screenings, and preventive lifestyles. Well, both vaccinations and screenings are free in most developed countries. Like Australia here, women get it free. But this is not the case in Nigeria. And for this reason, the costs are beyond what most individual women can afford. Unfortunately, early cervical and breast cancers present without symptoms, meaning that most diagnoses are too late in Nigeria for women to be saved. This means that only preventive lifestyles are available to us. Well, we know they're effective because they directly empower women to protect themselves. The measures are all free or of low cost. So why are we not doing this in Nigeria? What's the problem why we can't just do this in Nigeria? Well, despite the low and free cost that we mentioned about, the knowledge about them across the country is poor. So, preventive lifestyles can help. And these include for cervical cancers, limiting early and multiple sexual exposures. And for breast cancer, being breast aware. And this includes, but not limited to, breast self-examination. We'll talk about this later because on its own, it does not save from breast cancer deaths, but it does help. So health empowerment campaigns which we promote can help engender preventive lifestyles. It can improve the knowledge and preventive practices among our women. It can improve perceptions of women towards these preventive measures. It can improve screening uptakes. And finally, it can improve the adoption of positive behaviors. All these four items are proven by research that health empowerment campaigns that promote preventive lifestyles are effective on. Fact is, poor statistics in Nigeria and other developing countries are due to poor awareness. But this is what's affordable, this is what we can do, and this is what works. So how do we bridge the gap? Hearing steps in the OCI Foundation, that's why we are here, and that's why we're making this presentation to you. Now, a bit of background on the OCI Foundation. It's an international NGO. It's registered fully both in Nigeria and in Australia. It has its trustees and directors across four continents of Africa, Europe, North America, and Australasia. These individuals are on our website, and you can have a look and see them for yourselves. Now, even more importantly, it has a DGR status in Australia. Now, this status is reserved for special charities only in this country, and that's because donations to them are free of any tax issues. Only the best get this recognition in Australia. The OCI Foundation has been at the vanguard of anti-breast and anti-cervical cancer empowerment in Nigeria since 2017. We've had a three-pronged approach to our activities. We promote and advance health, we advance education, and we advance social and public welfare. However, the current sponsorship and partnership focus is on promoting and advancing health, and that is what we're talking about today because of a project called the Arm Our Youth campaign, otherwise known as the ArOY campaign. What is it all about? Well, it's a health promotion initiative. That's simple. But then it's endorsed by the Harvard Medical School, Boston, the USA. By the way, the OCI Foundation's president is an alumnus of this great institution. The ArOY campaign is backed by research evidence with publications in international medical journals. There's a planned support from the Griffith University School of Medicine here in Australia. The program is designed to integrate anti-breast and anti-cervical cancer teachings into the regular academic curricula across all the 3 years of senior secondary schools in Nigeria, SS1, SS2, and SS3. In addition to this, through a mobile phone application, the program aims to reach every single Nigerian woman from the age of 15 and beyond. The app is in advanced stages of production here in Australia and will be freely available to everyone. It will hopefully help mitigate the whole program in its entirety, will hopefully help to mitigate the risks of cervical and breast cancers. And it's in line with the United Nations Sustainable Development Goals with items 3, 4, 5, 10, and 17 all in play. It is the first of its kind anywhere in the world, and it provides a template for other developing countries to follow. So what we are doing, we're pioneering this great project, and your company can be at the very vanguard of this project. So what's the implementation plan? Just a bit of a quick run through. It's going to be a phased introduction. And over the next 6 years from 2019 to 2025, the whole Nigeria will be covered. The rollout is planned with a groundbreaking ceremony in Anambra State from October 2019. The choice of Anambra State is simple and is informed by a number of reasons. Since 2017, the OCI Foundation's health promotion activities have been held in that state. The campaign is already popular there with stakeholder buy-ins, and the foundation's headquarters is there. The ArOY campaign has measures to ensure engagement from the students that will participate in it. First, the teachings will be repeated over 3 years across SS1, SS2, and SS3, and it has inbuilt examination assessment procedures in place to make sure the students engage properly with them. And there will be constant evaluation through qualitative and quantitative research measures. How does this benefit your company? Why would you be part of this? Well, I can assure you this will be the most important corporate social responsibility program for your company. We're very confident of this because we'll be touching millions of lives across multiple states and with many individuals with full attention to this. There's opportunity for ad hoc or sustained partnership and sponsorship. It can be part of your company's corporate social responsibility. And sponsors and partners can consider specific states in Nigeria or be part of the entire national pursuit. We'll get vehicles that will be branded with the messages from our partners and sponsors, including your company if you decide to go with us. And these vehicles will be driven across the length and breadth of Nigeria. There's widespread national and international media coverage, with sponsors and partners always in the news. When we get to the gallery of this presentation, you understand what I mean. And the mobile phone application, this is the big one. But we'll go to it in this gallery below. But what benefits does it offer? A provision is made on this app for partners to present their messages and logos. And this will be available to every Nigerian woman from October 2019. Yes, October 2019, a few months away. And there will be estimated 100 million users. The female users will also most certainly have men in their lives, either as partners or family members or colleagues. Essentially, our partners' messages, including your company's messages, will potentially reach all adult Nigerians. Benefits to sponsors, another part of it, the launching and the courtesy visit will include thousands of materials branded with our partners' logos, names, and messages. There will be thousands, hundreds of thousands of souvenirs and outfits, t-shirts, caps, mufflers, and so on. Governors, ministers, National Assembly members, CEOs, and so on will all be involved. So the exposure is huge to who is who in Nigeria. And there will be books, hundreds of thousands of them, donated to all Nigerian senior secondary schools. Sponsors' messages and logos will be placed permanently on these books. Imagine how many individuals go through Nigerian senior secondary schools, both boys and girls. Their message will get through to them from the very onset. There will be millions of Nigerian youths that will use these books in the coming years. Now, workshops will also be held for school teachers that will be involved in the teachings. There will be opportunities for sponsors to present their messages during workshop tea breaks and during the workshop itself. There will be branded workshop materials, writing materials, bags, name tags, booklets, and so on. You name it, it's there. So let's look at the gallery. What and what are we going to find? Well, this is the registration certificate from the Australian Charities and Not-for-Profits Commission. This is from the CAC Nigeria, Corporate Affairs Commission. So what we say is right. And this is the letter from the prestigious Harvard Medical School endorsing this very program. So you're going to be in good company. Well, more on the gallery. This is the interface of the app. This is the login page. The app is real. It's already happening. There will be a video message, as you can see here, directing women on what to do with breast cancer. And there will be messages if you like. And most importantly, we have a space for adverts. So feel free to be part of this. We're in good company. We're in prestigious company. And just a bit of an idea of what we've been doing. This is in 2017, the OCI Foundation. You can see the video presentation we are in there. You can see the students. There are hundreds of students involved in this program every year. More on the gallery, publicity and newsmaking opportunities. There will be huge, both national and international. So this was a news caption in a Nigerian newspaper. And that's the OCI Foundation's president graduating at the Harvard Medical School, flanked by 2 Harvard professors. So look at this. OCI Foundation partners Harvard Varsity to fight cancer scourge. And more on the news. This is from the Sun newspaper in Nigeria. Cancer Prevention Foundation partners Harvard Varsity to fight scourge. Your company will be part of this in the coming years if you partner with us. It doesn't end here. There is the WHO director in Anambra State of Nigeria. You can see the media coverage. She was at our health campaign event in 2018, speaking with wide coverage from the papers, from the media channels. A search on Google will reveal this. It doesn't end there. Far away in Australia, here's the foundation's president, along with associates of this very program. The program is huge. You just cannot afford not to be part of it. Now, let's look at the involvement with Anambra State. Here's the letter, permission to commence the ArOY Youth campaign, 11th of June 2019. And there's more. Here's our foundation's latest with the Honorable Commissioner for Health in Anambra State. And here's our team members with the Honorable Commissioner for Basic Education in Anambra State. And here's our legal advisor, along with Professor Meno, the Honorable Commissioner for Basic Education in Anambra State. This was in April 2019. And there's the team with the Honorable Commissioner for Health, Anambra State, Dr. Joa Kabiki. I understand he is now no longer the commissioner, but the current commissioner is still with us. Now, the partnerships, quite a number of them. The medical school from Harvard, the Griffith University, entertainment industries, Nollywood. Okay, so just before we conclude, we'll look at the stakeholders and the potential and the existing partners we have for this. Of course, we've mentioned the prestigious Harvard Medical School in the USA. We have the Griffith University Medical School in Australia. In the entertainment industry, Nollywood, music stars, sports stars, etc. MDAs, women affairs institutions, education, youth groups, and the NEDC, the curriculum development in Nigeria. CSOs, PTAs, NANS, students' unions, ANCOPs, and NUT, a number of companies, the Girls Brigade, corporate organizations, international, governmental, and non-governmental NGOs, including the United Nations, and all 36 state governments of Nigeria and the FCT. And we said Anambra State is already on board. Now, on the summary, join us in this fight to arm our youths against breast and cervical cancers in Nigerian secondary schools, because we want to arm them young, because we want to arm them all, and because we want to arm them now. We'll do it person by person, family by family, school by school, town by town, state by state, zone by zone. We're going to fight this battle across these levels until national coverage is achieved. And it's simple. After all, we rise by lifting others. Thank you very much for listening. Please feel free to contact us. We can be reached on email, info@ocifoundation.org. You can be reached on the phone number there, +234 090 9937 5689. And on our website, ocifoundation.org. Thank you. Thank you very much for listening.